Hello, friends. This is Karan from HNR Speech and Hearing Clinic, Hyderabad. So today's topic is BERA test. So we shall be discussing all important aspects and commonly asked questions related to BERA test. So it will include what exactly is BERA test and how it is done and what will be the report and who all are eligible for this test and what all things we can diagnose from this test. So I welcome Neha ma'am, our chief audiologist in HNR Speech and Hearing Clinic, Gachibowli. Ma'am, welcome to the video. And we shall start with what is BERA test all about?
Thank you, Karan. So the BERA basically stands for Brainstem Evoked Response Audiometry. It is a diagnostic tool which generally evaluate the hearing ability of an individual by measuring your brainstem's response through electrical stimuli electrical potentials, which is measured via the electrode placed across your regions.
Yeah. And ma'am, how it is done?
So basically, the BERA test is done when the individual is not moving or is in a supine position. In kids, when we are testing infants, we generally prefer that they should be asleep while we perform the test.
Okay. And what if some kid is not sleeping at that time or in a playful mood? So, but test is urgent. So, what we have to do next?
Karan, what we follow is that when a patient comes, we generally tell patients or we recommend patient that, okay, you disturb the patients, the kids sleep, say for previous night, so that the next day when the child comes, the child is into tired and can have a natural sleep and we can do the test. In case this is not possible, then we generally recommend parents to go to pediatrician and get the sedative recommendation and which can be given to the child, while after which the child can get into sleep and we can perform the test.
Ma'am, how much time does it take for a BERA test to be done?
It all depends upon how soon the child generally fall asleep. But once for adult or once the child is into sleep, usually it takes somewhere around 30 to 40 minutes to complete the test.
Okay. So, ma'am, what it can diagnose exactly? What should we...
Yeah. So basically, Karan, the BERA test diagnose about your hearing sensitivity, or you can say that how much hearing loss you have, what is your hearing ability, and also tells us about the problem area. It's very specific test about the brainstem responses, so it tells us about that as well.
Mostly on the internet, if I research, I found it is related to children only. Or what age group is BERA test? What age group people can go for BERA test?
BERA test can be performed across all age group. Generally, it is done in kids because the traditional hearing test, which is pure tone audiometry, is generally can only be performed after 6 years of age. Wherein the BERA, we don't need any response from the child, and the child is into sleep position, so it's very easy and convenient to do that. But BERA can also be done in adult, wherein we have any malingering case. Malingering means that we are not getting a proper response from the pure tone audiometry test. In that cases also, or if we want to understand the problem area of that individual, then also we perform the BERA test.
Okay. What all precautions are required before undergoing this test?
BERA test the BERA test precautions are generally that you should be you should sleep quietly, or you should lie down quietly. You should not move, and you should not, you should be in a relaxed position. That's sufficient.
And ma'am, what about report? Like as a layman, if although it would be very difficult for me to understand like, what is report about, but just for a general knowledge, like what report can I expect, or what all important areas?
So basically, it's a graphical representation. I mean, there are some wave morphology which are which comes out. It's almost looks similar somewhere, like if you have seen EEG reports. So it's somewhere like similar, but then there are some wave and there are some peaks which are taken into consideration while diagnosing the BERA report.
So what to do in case hearing loss is being diagnosed by the BERA test? What should be my next step as a layman?
Okay, so there are two things. If suppose in a child the BERA report shows hearing loss, generally if it's an infant or some a smaller age group, we generally tend to repeat it after 2 months or 3 months to reconfirm that about the hearing loss. Wherein in adult, we generally, if we get, we reconfirm it through pure tone audiometry, or if there is a hearing loss which is detected in BERA, we uh, based on the report, we either give them about the hearing aids, or depending upon the pathology, we can also recommend them to go to the ENT doctor. The audiologist is the right person to tell about the report after the test is done, that what should be the next step, whether to go for the hearing aids or to go for the doctor consultation or whatever.
What other names like BERA is famous, like, or are there some other tests which are similar to BERA, or the names are same?
So BERA is Brainstem Auditory Evoked Response Audiometry. That is what BERA is called, wherein BERA is also named as Auditory Brainstem Response, ABR, or Brainstem Auditory Evoked Potential, BAEP. So there are various names, but it's the same test.
Can autism can be detected through it? Like people do ask.
Not exactly, Karan. Autism is not something which you can diagnose through BERA test. Autism is a condition wherein there are different aspects needs to be taken into consideration. Autism is entirely different, wherein BERA will diagnose about the hearing abilities. If a child with autism has any issue with hearing ability, that can be checked, but autism, to diagnose autism, BERA is not the tool.
Ma'am, at what age is BERA is suitable?
We can do BERA in infants also, in adults also, but generally it's been done in kids. The reason is that we don't need any participation from the patient side or from the individual. So once you are lie down or you are into a sleep, this test can be performed. So usually it is a very common and popular test for kids or in a smaller age group.
Ma'am, is it safe?
It's completely safe.
Okay.
It is completely safe.
Thank you, ma'am. Thank you for this valuable information. And I hope viewers will take benefit of it. And you are most welcome to visit HNR Speech and Hearing Clinic in Hyderabad, Punjagutta, Gachibowli and Kukatpally. Thank you.
Thank you.